Don't be afraid. Please, don't be afraid. My name is Scott Jensen. I'm a family doc, and I see a lot of COVID patients. I've probably got some 50 to 75 COVID patients that I'm involved with now. I've had COVID-19 myself and fully recovered. It was sort of a big nothing burger for me, but I know it can be a whole lot more than that for lots of folks. COVID-19 is real, absolutely. But the fear-mongering 2 days before the election is over the top. Dr. Fauci, I'm struggling with what he is doing. In today's paper, he says, we're in for a whole lot of hurt. It's not a good situation. You could not possibly be positioned more poorly. He said the U.S. needs to make an abrupt change in public health practices and behaviors. He said the country could surpass 100,000 new cases a day and predicted rising deaths in the coming weeks. Then he goes on to do a little whining. He speaks of Dr. Scott Atlas, a respected neuroradiologist who still sees patients, which Dr. Fauci hasn't done for decades. He says, I have real problems with that guy. He's a smart guy who's talking about things that I believe he doesn't have any real insight or knowledge or experience in. He keeps talking about things that when you dissect it out and parse it out, it doesn't make any sense. Okay, Dr. Fauci, let's dissect it out. Let's, in a few moments, look at a video that you made regarding, or that you were questioned on regarding testing. Folks, when we do PCR testing, we're looking for a little sequence or a little snippet of nucleotide bases. In DNA, they're adenine, guanine, cytosine, and thymine. So you could have, each one of these would be a base, and they're linked by other atoms or molecules. But that's what we're looking for. And when you cycle that PCR test over and over again, each cycling doubles the intensity of the search. And in a sense, each cycle compromises the value of the test. Many epidemiologists, infectious disease people, and laboratory people around the country, around the world say that if you cycle something more than 25 times in a PCR test, you basically will not be able to grow virus from that result. So you can tell someone that they're a positive PCR, but the fact of the matter is they're not infectious. As Dr. Fauci will say in the video, dead nucleotides, period. But the fact of the matter is, when you cycle so many times and you get to 40, which many of our PCR tests are doing, you're over 1 trillion times of what the material started out as. At that point in time, you could literally be grabbing onto a sequence of bases that didn't even originate with COVID-19 virus. That's one of the concerns. Could other coronaviruses, could other DNA material literally be triggering a test to be positive? That's why there's been information out there that 1,000 people told that they have a positive PCR test might actually reflect only 100 to 150 that ever actually had the disease. The other 850 to 900 could just be false positives, told that they have a positive, but they don't. The value and the quality of our testing is absolutely corrupted, and Dr. Fauci knows it, and yet that doesn't stop him from fear-mongering at a level that's literally astonishing. Before I have you watch Dr. Fauci's video, I want to just show you this chart here. This is the US. Cumulative tests per million, confirmed cases per million, confirmed deaths per million. What do I want you to see? I want you to see that the deaths per million are flat. It isn't going up. After we watch Dr. Fauci's video, we'll go over some more data to look at that. So please, take a look at what Dr. Fauci has to say when he's questioned about PCR testing.
Right. Again, a good question. And what is now sort of evolving into a bit of a standard that if you get a cycle threshold of 35 or more, that the chances of it being replication competent are minuscule. So that if somebody, and we have patients, and it's very frustrating for the patients as well as for the physicians. Somebody comes in and they repeat their PCR and it's like 37 cycle threshold. But you almost never can culture virus from a 37 threshold cycle. So I think if somebody does come in with 37, 38, even 36, you got to say, it's just dead nucleotides, period.
I appreciate Dr. Fauci being so straightforward in making those comments regarding PCR testing. In the middle of the 2009 swine flu epidemic, CDC officials came out, I think in July of 2009, and said testing has almost become meaningless. In other words, it wasn't providing much to the conversation. I think that's where we're at today. We have got to focus on some of the numbers that are not as easily corrupted by quality, manipulation, whatever. This is a graph of the World Health Organization's perspective of the death rate right now. You can see it bumping up, but now it's flat. If you look at the death rate on a per million population, and you look at the last 7 days, the United States deaths per million are about 14.2. We're lower than Spain. We're lower than Chile. We're lower than the United Kingdom. We're lower than Argentina. We're lower than Colombia. We're lower than Armenia. You know who's really low? Sweden at 0.1. The US is at 14.2. If you look at total deaths per million, the United States is lower than Mexico, Ecuador, Chile, Brazil, Spain, Belgium, Peru. If you look at this graph, you might see that big blip and say, wow, that's not a good place to be. That's Belgium. And the worst, the US graph is right in here. But the bottom line is, today, newly confirmed COVID-19 deaths per million people on a 7-day rolling average, the United States today is lower than Belgium, lower than France, lower than the United Kingdom, lower than Italy, lower than Europe, lower than the Netherlands, lower than Israel. We're lower than South America. We are slightly higher than the world. We're substantially higher than Sweden. We topped out somewhere around 8 deaths per million per day. We now are closer to 3. Many countries are 4 to 5. Sweden is less than 1. The bottom line, folks, is we are not being given the information we want. Here in Minnesota, we have been denied easy access to knowing what the statewide occupancy rate for COVID-19 patients in the ICU and the hospital is. That makes it difficult for us to understand whether or not our healthcare facilities are being overwhelmed. You might say, well, why is that a big deal, doctor? It's a big deal because incredible, large impacting policy decisions are being made on this. And I am worried about Governor Walz deciding to, once the election is over, put in some more draconian measures. Lockdowns will not solve this problem, folks. And inflating case numbers isn't going to solve the problem. Common sense stuff is going to solve the problem. Things that humans have done for hundreds of years. Don't go out to work if you've got a fever, cough, or shortness of breath. Cover your mouth. Leave your hands off your masks. Don't touch your nose, your eyes, your mouth. These are the things that are going to matter. But when Dr. Fauci comes out and starts picking on other people, starts whining and tells us that the world is going to collapse and this doom and gloom, I'm sorry. I've just had it with Dr. Fauci. I don't get it. I really don't get it. This is Dr. Fauci's comments about the PCR testing that you just saw. We are going to have to start listening less to the people who think that this case number is so terrible. Focus on hospitalizations, ICU usage. Focus on how many people have active disease at this time, because we are certainly seeing hospitalizations shorten up. We've seen the fatality rate in hospitals drop from 27% down to 6%. So there's a lot of good things going on, and frankly, the fear-mongering isn't one of them. Honestly, we'll do better, we'll be healthier, we'll be stronger if we have some hope in our soul rather than just fear. Thanks for listening. I really appreciate it.